on the job. Our job is to advocate for our patients, and we do it, and that's what we want to do, and they instead turn all of that into their individual profit. It's shockingly wrong. And CNA, NNU stands up for patients across the nation and Medicare health care for all. That's the solution to this fight. Elsa Matos, one of your own as well, is going to come on up now. We do have stairs over there, but we keep making people come from this side.
Hi. I've been a nurse for 22 years in this with this corporation, and I just want you to know that you're spreading lies about us, telling the people of this area that we have an $84,000 pension to rely on. I brought my pension papers today after 22 years, and I invite you guys to come and look at them. After 22 years of service, I'm supposed to get $497 a month to rely on, okay? And so I invite you guys to look at this. Shame on you! Shame on you! Shame on you! And I like to remind you that this corporation made $878 million just last year. $108 million just between this hospital and the one in Oakland. So this corporation is not hurting, but they're trying to hurt us. And we're going to fight back.
I think that the people here are very insensitive to nurses, their retirement, and they don't give a damn about the patients. And I'm just here to support them. And it's so important, especially for the people who are a little less fortunate than we are. I mean, it goes from one level to the next. It hits them first, and now it's going up the ladder. And
they say they don't have any money, but they have money for...
Absolutely. For all of the unnecessary things. All of the unnecessary things, the things that mean a lot, they don't care about. If we sit back and do nothing, what good is it? We have to try.
Community hospital, and then try to leave the patients, abandon them, build a nice fancy new hospital in the northern part of Santa Rosa, and totally leave the poor people without health care. Luckily, we had a health care agreement, but where they haven't had that, we've had major fights with them. At St. Luke's in San Francisco, they wanted to leave the people in that community without health care. So I think what we need to remember is that Sutter is not standing up for patients. And so when they talk about us greedy nurses out there, they need to look at themselves in the mirror and really own up to the fact that all they're out there to do is make money. And it's the nurses that have held their feet to the fire to keep St. Luke's open, to make sure that the patients in Santa Rosa get the care that they need, to make sure that the communities here get the care that they need. So, you know, they've got to really look at what they're saying, and people that are in the media also need to look at that as well.
I'm a labor and delivery. I've been here for 10 years, and this is a wonderful place to work with amazing nurses, and we do great care. And we're basically here because our contract is up for negotiation since June, and they're planning numerous takeaways from our current benefits, health care. They're going to eliminate various positions, which I feel strongly about, which are every weekend positions and part-time casual positions that are particularly important for working families, families with young children.
We're here at a rally for the Nurses for Sutter, and we're wanting to fight back. We want to make sure that they don't take away our sick leave. We want to make sure that we still keep our healthcare benefits. Overall, we want to take care of our patients, and our staffing has been.
What's going on with the staffing?
Honestly, I think sometimes we try to cut corners. At least it feels like the more patients are coming in, I feel like we don't have enough staff coming on duty at times, and I feel like patient safety is, it's not. I always feel like it could always be better, whenever I work. I think it's even harder at nighttime when there's even fewer staff, but, we feel it on the daytime too as well. That was probably one of the biggest complaints, is that we just don't get enough staff at times.
Well, the management says they have to save money. Do you think that there's a problem? They're saying that nurses are overpaid, and that's their argument.
No, I really don't think that's a fair thing to say. My goal is to try and make sure my patients get better. And if we don't have enough staff, that just can't happen. And I think that's terrible that they're saying that to us, that they're putting these lies against us.
I'm sorry, but Mama Fry needs another house in Tahoe. So I'm going to have to ask you guys to go back to work. And that sick time, all that money that you banked, so Mama Fry really needs it, I'm sorry. So I'd really appreciate it if you guys would end this strike, take our takeaways, and get back to work.
Eric Cook, I'm on the negotiating team.
Okay.
Though I had my costume on as Pat Fry. The idea that nurses have to pay for their own health care is pretty ridiculous. You even get a free banking account when you work at a bank. And the idea is that we did the math for them when they gave us the numbers. They will actually be making money off of us when we pay for part of our health care. Okay, you're asking somebody to wipe the table when they sit down, charge them because the table was just clean. It's an utter ridiculous concept. All the ads they've been running, when confronted on them, I was at the bargaining table, so I can swear to you, their words were, they smirked and laughed, and then they said, "You have your ads, we have ours." The bottom line is, we can't afford, CNA cannot afford $375,000 to $500,000 to put a 3/4 or a full-page ad in the newspaper. We can't afford that. So they can put that blast out in the ad, and it's almost impossible to get a retraction on that. They've admitted that it's false. I don't know, there's a young lady named here, Betty Enright over there, who actually has her retirement thing. It says how much she's going to make. And I want you to do the difference between $84,000 a year and what it says she's going to make after she's been here over 40 years. She just celebrated her 40th year. You should see the paltry amount that she's going to make. It's like $600 a month. Now,
So why are they crying that they can't afford it, and why are they saying that you make too much money in retirement?
well, I think when you look at it, if you can get away with lying, you'll do it. And that's exactly what they're doing. They're preying on all these people that are suffering out there. Let's be honest, if you were struggling like so many people are here in America, and you come out and say, well, this person makes $100,000 a year, you're not going to be sympathetic when you're working 2 jobs to make $25,000 or even $30,000, probably less. So by putting out those lies, you automatically isolate the nurses from any kind of public sympathy, which is exactly what they're doing. But we can't counter that. We don't have $500,000 per ad. So we just have to do it the old-fashioned way. We have to tell 2 people who tell 2 people who tell 2 people. We have to just build an exponential growth of what the truth is.
But do you think that these private owners of the Sutter Foundation are really interested in providing good health care for people in America?
I don't think so. I'm sure there are some doctors on there that do have a heart, unlike the Grinch. But I don't know if you're familiar with the recent studies show that many CEOs and those who rise up in the business community do have sociopathic tendencies. There is no doubt that many of the people in the head of Sutter do have sociopathic tendencies because we take care of sick people. Nobody's here doing it for, we do it because we care. Nobody does the things we do just for money. That is insane, because I think many people, if they're given the opportunity to do what we do every day, would not last 2 hours.
It's a pretty intense situation in this hospital.
It's intense. I mean, and we have to do it with compassion and keep a person's integrity, you know? I mean, people that lose control of all their bodily functions and you need to be able to handle that person and treat them with respect.
Now, some of the nurses here have said that there's a shortage of staff. There's a real problem which possibly threatens the health and safety of the patients.
Well, what they do is we have the staffing ratios on the book, but there's a lot of ways to manipulate them. Like, for example, they'll hold patients until after the time of shift. When we make staffing, they say, oh, well, what's that number? Okay, we're going to staff you for that. Then we find out they have 5 patients down in the ER for us, which would give us more people to take care of them, the appropriate number of people by law to take care of them. But they withhold those patients until after the time is, you know, so they'll cancel staff, send them home, and then give us lots of patients.
Is that legal? They're manipulating the figures?
Manipulation is very easy. All they have to do is say that they made the best intent to bring people in. So once they give us the patients, they say, oh, we'll call somebody back. And then they can tell the state, well, we tried our best to do that. They clearly do this to save money. And there are managers who have told me that have worked at other Sutter hospitals where they'll actually tell them, hey, short staff them, they'll never know. The state's too broke to come in and look. And you know, our state doesn't exactly have money to be checking to see if nurses are fully staffed or not. And that's exactly what they're preying on.
There was an incident in the last strike where they brought in replacement workers, scabs, and somebody died.
What happened was, it did not happen on the day we struck. It happened on the next day. And what happened is the nurses came in. In fact, the very nurse who would have been working and taking care of that patient came in to go back to work, but she was locked out punitively. As you know, the hospital said they have to contract these people for 5 days. And if people did some good research, there is a big connection between the strike-breaking nurses that they bring in and their shadow corporation, the ACES Registry, who's actually run by a former Sutter employee. So we would have been in there taking care of that patient. But this 23-year-old nurse from New Orleans, which I have to be honest with you, 1 year out of nursing school, maybe she was a girl genius, at nursing school, and she graduated early. But she doesn't have a lot of, water under the bridge to be experienced enough to travel across the country to a new hospital and take care of patients for 12 or 16 hours a day. And she clearly made the mistake she made was just, it stymies us, because the tubing, she hooked up tube feeding that should have went into somebody's nose or through a GT tube, she hooked it up into an IV. So instead of going into somebody's stomach, it went right into their veins and was pumped into the heart. Obviously that person passed on. That should never have happened. And there's no way that would have happened if a regular staff nurse would have been in there.
Now they're going to lock you out tomorrow? That's the plan as well?
Yes.
What's happening with that?
Well, now they've said, they always say they have 5 days they have to lock you out. As you know, Kaiser, the nurses struck one day, they came back the next day, right? However, they said they brought the nurses in for 2 days of extra training. Then they're going to work the strike day, and then tomorrow, and then they're going to eat the 5th day and send them on their way for the 24th. So yes, they're locking us out one more punitive day. So we're ready to go back to work tomorrow, but that's their plan.
Have any criminal charges been brought against Sutter executives for the deaths of patients for not having proper physicians? I mean, was a nurse licensed in California, for example?
CNA has brought up those allegations that we'd really like to see if all those nurses actually had California licenses. And I would put a challenge out to anybody. You can go to the ACES website. We have our chief negotiator is not a nurse. He took the ACES test, and he got 9 out of the 11 questions right. That qualified him to be a nurse on the floor here. Now you tell me that somebody is on the street here can get 9 out of 11. He's a bright man, so maybe, he got 9 out of 11. So that means somebody who has no background in nursing outside of negotiating and hearing us talk and give him stories, he actually was qualified.
How is that allowed?
I don't know. You'd have to ask the millionaires at Sutter, who are whatever they do to get these people that are not qualified to work in their hospital. We actually were told that we had a lot to live up to because those nurses that worked during the strike, those strike breakers, did a fantastic job. That was told to us. When we went in to take care of the patients, the first thing they said is, you're not one of those replacement nurses, are you? And we said, no, we're regular staff. They said, oh, thank God, it was terrible here. We were on the call light all the time. I was in so much pain. But yet they said it was safe and that they gave great care. One of the things the hospital wants to do is actually mandate and put into the contract this ridiculous concept about patient satisfaction in terms of was the food up to par? Was it great tasting food? Did you get excellent service? Well, sometimes when a person comes in with a heart attack, you have to tell them, no, you can't eat that hamburger right now. We're not doing that to be punitive, to be mean, to be those terrible nurses. We're trying to save people's lives. So patients aren't always satisfied in that case. But they want to mandate that if a person isn't satisfied, we could be disciplined for that. It is absolutely insane. It underlies any idea of critical thinking that's involved with the profession of nursing.
Who's in charge here?
Well, I guess we ultimately could say, like any place, Pat Fry's in charge. And now we have David Bradley and this Chuck Prosper, who were previously at Marin Hospital. And as you know, they absconded with $120 to $130 million of Marin Hospital's money, Marin General's money. Now, they said they did it because that money was really Sutter's money. Marin, on the other hand, has a different story to tell. So they brought these people over that are being sued in civil court for that money. You know, they took money from another hospital and brought it to Sutter corporate. They're going to try to do the same thing here. And we were told there was a Sutter executive, though he was in the tech part of Sutter, so he doesn't really buy into the whole thing. His thing is computers. He told one of our nurses that he was involved in a meeting where they said, our most important thing to do is we need to break CNA at Alta Bates Hospital, because once we break them there, we can break them at all the other hospitals. And they had already been in talks with Kaiser and California Healthcare West that's what they wanted to do. So it would be good for the hospital industry if they can decrease not only the standards of care, but the pay and benefits of nurses. Because if you're not paying it to all the nurses who actually do all the work, where does that money go? It goes into their pockets.
And do you think you should have private control of the healthcare system? I mean, like Sutter and these other private hospitals?
Well, I think we're always going to have some sort of private control. Maybe not of hospitals, but obviously we'll have surgery clinics and things where people do private cosmetic things. But the actual care of the general community should not be in the hands of private money, because let's be honest, their ultimate goal is their bottom line, the money they make, not the actual care of the patients. I'm not saying that there aren't compassionate people involved in publicly owned hospitals. I'm sure there are many doctors that are on boards that really care about patients. But ultimately, the people that are really making the choices are really about the bottom line, and that's money.
And they're spending a lot of money fighting the CNA, fighting the workers here?
As much money as they spend fighting against single payer and CNA, if they stopped fighting us, they'd have a cornucopia of money, okay? But that's just not their nature. Their nature is to try to wring every penny they can out of the nurses and the public, and that's the bottom line. That's all they care about. It is Grinch-like, their behavior.
And what should people do about it who want to support your struggle?
I think people need, I don't know if the papers afterwards, even though the papers came out kind of on the negative towards us, if you read the editorials that appeared, they weren't written all by CNA nurses. They were written by public people who came out in favor of us. We need to get the public. The public needs to write to them. Needs to write to all the public, their congressmen, their mayors, everything. We need to mobilize people against these corporations. Come out to the strike line. everybody's welcome here.
What about the district attorney prosecuting these executives for bringing in these people who aren't licensed, possibly?
Well, what we need to do is they're very loath to turn over those records.
Well, this is a potential criminal.
Of course it is, but we're hoping that, but as you know, the wheel turns very slowly when it comes time. We've learned this at the negotiating table. When we ask them, when we get pointed questions where we point out they made an error in their math, they say, "Oh, so sorry, our math wizardry was off. I apologize, and let it be placed on the record that there was no malintent at all with this. This was simply it was written wrong. It was typed up wrong." Oh, and he looks over at the secretary. The idea is that it's only illegal if you get caught, right? Nobody's going to know unless you get caught. So that's exactly what they play on. Just like in negotiations, that's a microcosm, except they're doing it Sutter-wide. So it's going to be a while for that district attorney or anything to weed through all these things that are going on. Because even when we asked him, we told him, we said, "We did this math. You're going to make money off us on our health care." Really? Mary? We weren't aware of this. We'll have to get back to you on this. Whenever we catch them like that, it's always, "We'll get back to you on that."
Do you think it should be legal to have replacement workers or scabs come in and replace workers?
No, I don't. I don't think it should be legal. I know that the patients need care, but the bottom line is they should be settling with us. Everything we're asking for we've just asked for no takeaways. We asked for better security in the ER, of which they're balking at that. We have a thing called a Code Silver. At Summit, a person brought a gun into the ER and shot out some of the windows. And their excuse was, well, there was a sheriff's deputy there and he didn't do anything, so we don't really need to have more security because he wouldn't have been able to do anything anyway. Well, I don't know about you. I was in the service. I was shot at. I shot at people. The bottom line is, if somebody comes in with an automatic weapon and you have a .38, the odds are you probably should hit the deck. You're not going to be challenging them. But their excuses are just, they clearly want to save money. We are asking that we wanted them to put a metal detector in the front of the ER. So it would prevent a lot of these people from coming in with weapons and things like that. How much does a metal detector cost when you made $120 million last year? When as a corporation you made $920 million.
So they made $920 million last year.
Last year.
And yet,
not this hospital, the
Sutter system, and yet they're attacking the CNA and say they want givebacks from you. They want you to pay no sick, take away your sick pay, make you pay for medical care, and they made $920 million.
Their idea is, they said, Sutter, unlike these other corporations and the rest of the country, they're not playing kick the can. We're not going to put off tomorrow what should be done today. The idea is bad things are on the horizon. We don't know what's going to happen with Obamacare. We don't have nobody knows. Nobody's asking them to be Nostradamus. Nobody's saying, "Can you do this?" We're just saying, you made $920 million last year. Okay, that's Sutter corporate. This hospital alone made $120 million. So they're not for profit. Did we reiterate that? Not for profit. Okay, so say they say they're only on pace to make 70 or 80 million this year. You're a not for profit. Okay, if this was Highland Hospital and they were losing money because of the county and Alameda not being able to, be fully funded, we could understand that. But they're making 70 to 80 million this year, and we're of course taking their word for it. That's what they admit to. Lord knows if we really got full disclosure, we might find out they made more than 120 million this year. So how can they make these cuts justifiably for the future? Who knows what's in the future? If Sutter knows what's in the future, please tell me. If they have a crystal ball, share it with all of us. I'm sure public officials would like to know too. But their claims is that in the future things are going to be terrible for us. So they want to make the cuts now. My idea would be, what are you doing with the money you would save? If you're taking $50 million from us, what are you going to do with it? Are you putting it in a special account for us for later? I have 900 hours of sick time. Okay, I stopped accumulating at 1,000, and I had a hernia surgery. That's how I got down to 900. What happens in the future if something dire happens to me? They want to take that away from me. 900 hours. I don't know if you know it, but when you have sick time, they have to keep that money on the books so that it always is accounted for. What's going to happen to my 900 hours that are on the books? What do they do with all that money that they have to account for now?
So that's a give back.
It's a give back. What's going to happen to that money? They're going to pocket it. So all the sick time they strip from us automatically goes into their pockets. So, for example, what we found out here is some of the people that are not represented by the union, they initiated this draconian PTO plan that they have. Well, they don't have sick time anymore, and their vacation time is accumulated at a slower accrual rate. Well, whenever they're canceled, the hospital pulls from their vacation time to pay them. So the young lady says, I don't have any vacation anymore. I can never go anywhere with my family because whenever they cancel me because they don't staff properly or whatever, she loses whatever hours of vacation they accrue. Now, how can this person, I mean, you can't plan your life. You get up ready to go to work. Oh, I'm canceled. Okay, thank you. Hangs up the phone. It's not like you plan for a cancellation day. So this woman never will get a vacation. This is what they plan on doing.
That's the Grinch on this Christmas 2011.
And their idea is you should be happy to have a job. Where do they get their money from? They get it from Medicare, Medi-Cal. They get it from private insurance companies. They get their money. It's from the public is where they get their money. They're not paying us really out of their own pocket. It's not like they built this thing and the money came from Pat Fry's own bank account. It comes from the public, the people we serve. That's who pays our salary. And I think if you would ask the public, you know, did you get good care when you were at the hospital? Did these nurses help save your lives? I'm sure they'd rather pay us than Pat Fry.
What's going to happen tomorrow?
Well, they've already announced that they are going to lock us out. So what happens is nurses will not report back to work until 07 on Christmas Eve. That means 07 Christmas Eve morning. That's when the nurses, the real nurses, the fully qualified nurses will be back in the hospital.
Treasurer of National Nurses United, and I'm a Children's Hospital Oakland nurse. Last time you did this, we were also on strike, but we just got a settlement. Sutter has to settle with us as well. Nurses across the nation do not take this light.
To you for 35 years. I've worked at Alta Bates for 40 years. And they're putting out ads that we're going to get we'll get $84,000 a year to retire. But this is actually what I'm getting. This is my latest retirement package.
So it's only $671.
That's right.
After how many years?
That's after 40 years. So if they can give me $84K, I say bring it on, and I'll be happy.
Are they actually saying that nurses make...
Well, do you remember 3 years ago they put an ad in the Chronicles saying that we were going to retire on $145,000? They say this to the public because they want the public to... They don't want us to have any public support. Like we're greedy dogs wanting more and more.
That's what people don't understand. I understand the public.
And right here it says I started there in 1971. You can see that.
So you've been working how many years?
40.
And this is what
And I still love my job. I must say I do love my job. I love my work. I love working with the patients. I believe they just want to bust the union so they can be ordering us around, because the words they used in the newspaper today is the union is ordered the nurses. The union doesn't order us to do anything. We work in a collective process and we decide for ourselves what we think is the right course of action for the nurses and the patients. They would like to be ordering us around, and if we didn't have a union, that's exactly what would be happening. I love working here. This is my community. And I love the patients.
So what do you feel about these ads that they're putting in the paper? You know, they're spending apparently hundreds of...
Lies. They're bold-faced lies, and I'm totally disgusted that they would do this. Because what they're doing is trying to get the public to not like us, to think that we're not credible. It's lies. And when they sit at I heard that the negotiator sat at the table and said, $84K, we'll all retire right now if if that's the case. And I heard that they smirked and said, you have your advertisements, we have ours.
Isn't this false advertising?
Well, yeah, it is, but if you have enough money, you can buy anything. That's the problem. So that's why we're out here. And we shouldn't be out here. I'm very angry that we have to be out here doing this. We should be in there taking care of those patients. And this management at upper echelons of Sutter, they need to be listening to the staff.
Do you think they ever will?
With the strength of a union, they will have to.
I just want to thank all the nurses for the hard work that they do every day at the bedsides. We're saving lives. We're doing good work, and this is the good fight. We won't be silenced. We won't be devalued like they want us to be. We will continue to fight for the right things, for the care of our patients, for our rights, and I just appreciate everybody being here and doing the right thing.
They say cut back, we say fight back.